My background is at NHS England. I'm one of the digital clinical champions who advise on the digitisation of primary care transformation. And over the last few years I've worked an awful lot on the patient online, so patient-facing applications, sometimes known as GP Online. So that's ordering prescriptions, booking appointments, accessing your medical record, GP Online consultations, and that wider agenda. So NHS England were approached to see if they could provide somebody with that sort of patient-facing experience to lead and coordinate their data sharing agenda within the Great North Care Record.
Why is it that the Great North Care Record's approaching consent in the way that it's been done?
The background to this is one of the biggest lung studies that was done in Salford, and it's reported that to actually get patients to come into research trials to help improve treatments, the time taken and the money taken to actually identify, contact and consent those patients into those research trials was in the tens of millions of pounds, and it took several years. What we'd like to do in the Great North Care Record is offer a platform, a digital platform, where patients can opt in to be contacted for research trials that are appropriate to them. So if they've already opted in that consent piece and opted in to be contacted, so it's not to take part in the research, it's just for the researchers to contact them. If there's an appropriate research trial comes up, it means that there's a database there that patients have already set those preferences on, and researchers can then query that database and contact the patients directly.
What have been sort of the biggest challenges in doing this piece of work?
We've done a lot of work with the patients and public. There's been over 20 focus groups done with patients and workshops looking at how they'd like to be contacted, what are their concerns, would they opt into research trials, would they let people actually look at their data, not necessarily just opt into research trials. So we've been very much led by what's come out of those workshops. We're also working with a project called Healthy New Towns in Durham, in Darlington, where they've developed a platform that will automate the contacting of patients and citizens, and then they can then set their preferences within that. So at the moment we're just trying to finalise the wording so that people understand it, what it is that they're actually saying yes to or no to. And that's in development and it's in testing.
So you talked a lot there about the public engagement that we've done. What about how we've engaged with professionals working in the health and social care system?
So there's been two major events, one held just in July this year, just gone, and we had 350 people attend that. We did have citizens within that, but it was mainly a professional engagement event just to update people, get their views on how we develop those consent preferences and how make sure that we're going in the right direction. So there was an awful lot of learning from that. The first one was over 12 months ago, and there was a lot of, it was at half the size of the meeting, but that was the start of the journey. The other professional engagement tool that we do have is in the region. We have a regional online collaborative platform, and there are all sorts of discussions going on there, and we're trying to increase the numbers on that platform to be able to make sure that we get everybody's voice on there from a professional point of view.
What have been the key sort of achievements to date?
I think there's a variety of different projects going on, because obviously we have to look at proof of concept and make sure things are working. So we've got a variety of care pathways who are doing that proof of concept across the region, and they include preferences about how patients would like or prefer to be contacted. Is it email? Is it SMS? Is it landline? Is it letter? We're aware with some of the work that's already gone on that different patients have different thoughts about opting into research or allowing people to look at their data, their health data, at different points in their health career or health lifetime. So it might you change, your preferences might have changed. So we want to be able to build a tool where patients can actually change that according to how they feel currently.